You may ask about the coronavirus, which is, very well under control in our country. The people are getting better. They're all getting better.
We have contained this. I won't say airtight, but pretty close to airtight. We've done a good job in the United States. Hats off to our public health people.
Well, the markets didn't like that at all. The president and his chief economic advisor trying to project a rosy scenario. At the same time, the professionals, the health experts, the scientists at the CDC were saying that it was not a question of if the epidemic gets to the U.S., but when, and that Americans should be prepared for disruption in their daily lives. More than 81,000 cases, 2,700 deaths so far worldwide. At the time we got on the air, it may more being reported every day. NBC's chief foreign correspondent Richard Engel is in Singapore, where nearly 100 cases have been reported, but more than half of those patients have recovered. Phil Rucker is the White House bureau chief for The Washington Post. He is co-author of the book, A Very Stable Genius. Also with us, Dr. Zeke Emanuel, special advisor to the director general of the World Health Organization and a former senior advisor to the Obama White House on health policy, now chairing medical ethics and health policy at the University of Pennsylvania. Welcome all. Richard, first to you there. Ground zero, really. Singapore, of course, and China and the other Asian countries where it all started. Now in Singapore, what are you hearing? How is it spreading?
So we came here because there is a lab where they're working very closely to try and isolate this virus, to figure out its weaknesses. I went to a lab earlier today and spoke with one of the top virologists in the world. And that in this laboratory, they are keeping the most pure strain of the coronavirus, and they have they have it, and they are trying to break down its genetic code to see what works to kill it. And they have some promising leads, but nothing yet. And the virologist told me that it is, in her opinion, going to become a pandemic. You cannot bluff your way through this. You can't market your way through this. You can't just tell people everything is going to be all right when the people who are working very directly with this virus say that it is a matter of time before it spreads. What she told me, what was most unique about this virus, and she's worked on viruses for the past 20 years in frontline experiences, is that it is so contagious. It is not the end of days virus. It is not going to kill us all. 98% of people get better. 98% of them often have mild symptoms, but that is still 2% roughly that die when they get this, and generally it is the elderly or people who are infirm because they have pre-existing medical conditions. And that, if you spread it out over the entire possible infected population, could be a very large number of casualties. She thinks this is going to become a pandemic. We also talked about where it came from, and that is important. That is important in this information age, because if you look online, there are a lot of rumors. Especially now, there are a lot of people going to Google trying to figure out where this came from. And one of the big conspiracy theories out there was that this was some secretive Chinese weapon or a biological weapon that was put out there or escaped. She actually worked in the facility in Wuhan that is often pointed to as a potential culprit for a place where this virus was allegedly being made. She says that is absolutely not the case. She is very convinced, about 90% sure, that it came from bats, and that it was from bat to human in a illegal wildlife market in Wuhan, China. So let's just hear a little bit of what she had to say. We actually went into a cage and saw some of the bats that they are working on and conducting research to try and figure out how the transmission happened and what can be done to find the vulnerabilities in this coronavirus.
So you don't think this was some biological weapon, some plot?
I do not. I don't think it was either intentional or accidental release. This virus came from the wildlife.
Came from bats?
Most likely came from bats, yes.
And came from bats in this wildlife market?
Yes.
And that was pretty extraordinary. With your reporting now, Dr. Emanuel, what have we learned about the mortality rate that I had heard from the World Health Organization was generally about 2.5% to 3%. This is not Ebola. But the transmission is also different. Why don't you with your expertise, tell us, having experienced
Andrea,
the other kind of disease?
You're 100% correct. This isn't at the extreme, either SARS, where we had about a 10% mortality, or Ebola, where you have a much higher mortality, can be as high as 50, 60%. This is closer to seasonal flu. Given the world statistics now, it's somewhere between 2.5% and 3%. But remember, those world statistics of 81,000 cases probably ignore many more cases that are so mild, people think they have a cold or a cough, but don't think that they have coronavirus. So even if you, say, dilute that number by 5-fold or 10-fold, you're down to about 0.5% mortality rate, which is higher than seasonal flu, which is usually around 0.1%. That's 1 out of every 1,000 people who get it will die from it. So it's very different. On the other hand, it's very transmissible, and that's what we're seeing when we've got these hotspots popping up in Iran, in Italy, and in other places where no one has been to China, but now you're getting transmission person to person, and that seems to be very easy. One person transmits it to about 2.5 to 3 people, and then they transmit it. And that's actually the serious problem is, as your correspondent mentioned, widespread transmission with a low death rate is still a high number. And I do think we all in America need to be well aware. We still have a very low number of cases. There are no cases, for example, I'm in Philadelphia, no cases in Pennsylvania. This is going to get worse before it gets better. And I think we need to be prepared for that. And it's been quite clear that the White House has been very slow in preparing or even recognizing this as a problem. I somehow think that maybe they thought closing the border to people from China would do it. At best, it's delayed the entry into the United States. It's certainly not going to prevent it.
And on that exact point, Phil Rucker, you've done so much reporting for your book, Very Stable Genius, on the president's responses. What we saw here was the president in India trying to reassure the markets, because he measures things by the stock market, as well as, Larry Kudlow, his economic advisor. And it backfired because the CDC was telling a more accurate forecast. Plus, they've cut the CDC budget. Secretary Azar is on the Hill today getting slammed over that. The budget proposal's been cut. Chuck Schumer says we need another $8 billion, not the $2.5 that have been proposed. These are proposed budget cuts. But science has been so downgraded in this administration that the markets can't really believe what they're hearing.
That's right, Andrea. And that's one of the challenges for this president right now. If, in fact, the coronavirus does expand and become a global pandemic, as many of the experts fear is only a matter of time. You have a president here who's been at war with science inside the government, at war with facts, who regularly exaggerates, manipulates the data and the truth in his public presentations. And this is a moment when precision is warranted and needed and necessary. The American people and the world really are going to be looking to the president to hear truthful accounts of what's happening, what they should do, what they should be fearful of. And if everything's okay, then they should hear that too. But it's a president who's not really equipped for this moment, given his track record and the way he has been so loose with facts and information, and the way he has discredited the scientists within the government, sought to diminish their power, sought to cut their budgets, and cast them out.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.